Good afternoon, everyone. Welcome back. If you are joining us for this first time, welcome. So we are back with our mental health awareness feeds that will be running throughout the month of August. In commemoration with Women's Month, I've got a team of wonderful women who have come together and they said they want to do this. They want to share their knowledge with us. Empower us. So please hang around, learn as much as you can, and see how you can be better equipped to support your family members, your friends, your acquaintances. So welcome to Queendom Chats, a place where queens and kings come together to share what they can, empower each other, and help each other build better queendoms and better kingdoms. So welcome everyone so you guys can grab a drink wherever you are, be comfortable. Please be comfortable, please engage as much as you can. If you've got questions, if you've got comments, keep them coming. Remember, we've got a team of professionals here, medical professionals. We've got a doctor, we've got a clinical psychologist, sorry about that. We've got an advanced psychiatric nurse specialist or something of that nature. Sounds very high level for me. So grab a drink, guys. I am having some hot chocolate today. Don't see if you guys can see. Friends of mine send this through to me. They are Afro Coffee, so they've sent this through to me to enjoy whilst I have this wonderful chat with you guys. So grab a drink, make yourself comfortable, be warm, and be ready to ask questions as much as you can. So this afternoon we're gonna have a wonderful lady by the name of Dr. Mahlatsi Thosago. Okay, I always get this wrong, guys. Please don't judge me. I always get her last name wrong. So get Dr. Mahlatsi Thosago. She's going to be joining us. She's going to break it down for us. She's going to be talking to us about depression, anxiety, substance-induced disorders. Yeah, there is such. I don't know what it is either. So we'll be hearing from her. So I can give you guys a moment, just a minute while we wait for her to join us. To go get your drink, go get your hot chocolate, your coffee, your rooibos tea, or something harder, if you do have such at hand. So let's just wait for her for a minute so she can join us. What is that lovely song that I was playing just now? Okay, guys, so Dr. Mahlatsi is here online with us. Hi, Mahlatsi.
Hello.
How are you doing?
Hi.
Welcome
I'm good, thanks yourself.
So this is a place where queens and kings gather to have meaningful conversations. To help each other build better, stronger kingdoms, so to speak. So I've got a drink here. I'm comfortable. I'm warm. Please make yourself comfortable. This is not formal at all. I remember you're very worried about that the other day. So this is very casual. We've got our viewers interacting with us. They'll be having questions. There'll be comments coming through. So yeah, can you please tell us who Mahlatsi is?
Well, Mahlatsi is a medical doctor working at a psychiatric hospital here in Limpopo. And well, I like hiking. I'm actually so exhausted. I came from a hike just yesterday. So
Yay, girl. Okay.
Yes. So today we're going to talk about anxiety and depression. Also, I will be talking about just an overview of substance use disorders.
Okay. Mahlatsi, can you please hold on for me for 1 second? Apparently, our viewers can't see our feed on the Facebook Live. So let me just make sure.
Okay.
Okay, I can see it, so I don't know what's going on.
Is it on the Facebook or?
Yes, it is. Okay, let's continue. I can see it, so I'm certain that all is well. So you
Which Facebook is it displaying on?
Okay, it's on a page by the name of Augustine Young Ambassadors. I also have it running on my personal wall. So yeah.
And then how can I run it on my personal wall?
You can go to my wall and share on yours if you can't find the page.
Okay, let me.
Okay.
Okay, I can see it on your wall.
Awesome.
So how do I share it on mine?
I think on the share button.
Okay, let's just see. Okay, share. My story, okay.
Are you coming on right there?
Yes, I think we're fine. Yes. Okay. So where do we begin?
It's absolutely up to you. My personal favorite is depression. I think it's the most overused word that I use. You know, come month end, the debit orders are hitting. I'm like, oh, I'm so depressed. My jeans can't fit from last season. I'm like, oh, I am so depressed. So, yeah.
Yeah. Okay. So I actually included both depression and anxiety as one because most people like to use them interchangeably. Oh, I'm so anxious about this. Oh, but I'm also depressed about this. So I'll just start there. So with anxiety, people, you tend to feel like you're ramped up, like you're anxious, everything is just up, right? And then with depression, you feel like you're really down. But surprisingly, both of these conditions are actually quite similar. You know, the way they seem different to be in the moment, but they actually have a lot of symptoms in common. And in some way, they have very similar thought patterns. And then with that said, depression and anxiety are not really specific disorders. I know, like you said, you like to say, oh, I'm always depressed or whatever, but they're not really specific disorders. They are just generic terms for types of disorders. So the most common ones that we'll look at closely is major depressive disorder, which is a real diagnosis, and also generalized anxiety disorder, which is also a DSM-5 diagnosis. Okay, so lots of people diagnosed with either MDD, major depressive disorder, or GAD, generalized anxiety disorder, tend to present with both disorders. About 2/3 of people diagnosed with MDD also have some kind of anxiety disorder. And also 2/3 of people diagnosed with generalized anxiety disorder present with MDD. Like I said before, generalized anxiety disorder is the most common anxiety disorder, but there are many other anxiety disorders, okay? Like panic disorder, social phobia, specific disorders. But today we'll just talk about the generalized anxiety disorder, which is what most people use to describe being anxious. So whether you have one or the other or both, the same medication is often used to treat the disorders, and that medication is usually an antidepressant. This is because this medication works on the neurotransmitters in the brain. So a neurotransmitter is a molecule used by the brain to send messages across the brain, right? So what researchers have found is that a person who suffers from depression and a person who suffers from anxiety, they both present with decreased levels of serotonin. So serotonin is an example of a neurotransmitter. So what antidepressants do is that they increase the levels of serotonin in the brain. So that's why you can use antidepressants to treat both conditions. Okay. So the most notable symptom of anxiety is arousal, not the sexual type, of course, but it's more of it basically means I don't know, right? It basically means that the person is on high alert. So whether it's psychologically, where the person will be increasingly aware of their surroundings, or physically, where the person will present with an increased heart rate or sweaty palms, right? So that's what we mean when we say a person is aroused, psychologically. And then it isn't a part of, and this is where the anxiety and depression differ, right? Is that with the major depressive disorder, the person will present with a low positive affect. So this just means that the person is not getting much pleasure out of life. You know, they are feeling lethargic, fatigued, not interested in things they used to be interested in. You know, they're feeling unmotivated, just you know. So those are the key factors which actually differentiate anxiety from depression. But when we look at the other symptoms that actually give you the diagnosis of generalized anxiety disorder or major depressive disorder, they almost have everything in common. For example, both present with restlessness, fatigue, irritability, problems with concentration, sleep disturbances. You know, like the list goes on the official criteria for either generalized anxiety disorder or major depressive disorder. Okay.
Sure.
So
and
then
this is all happening in the brain, right?
And this is all happening in the brain, and then it manifests itself on the outside, where you're seeing that, you know,
lethargy, you
you're
feel
feeling
tired.
down, tired, you can't concentrate. So you can either think that, oh, I'm depressed or I'm anxious. But like I said, the two symptoms that differentiate them is that with anxiety, you're more high alert, you're worried. Yes, so it's basically like you're worried. Whereas with depression is that you're down, you're not interested in things, you're just low. So now researchers have come up with models to try to understand both anxiety and depression. And the most common one is that flight or flight response, right? So the flight or flight response to stress it kicks in when you're confronted with a threat, and it automatically prepares you to either fight that threat or to run away, right? So when you think about it, both anxiety and depression are just different types of the flight response. With anxiety, it's often characterized as a sense of helplessness, like you're just helpless in a situation. And with depression, it's more of you're hopeless, right? So you're so hopeless that you're not even motivated to try to do anything. And then with anxiety, you're just helpless. You feel like even if you try, there's nothing that you can do about it, right? So with anxiety, you might feel like you're looking for ways to fight back, but what makes it a disorder is that it's actually a short-lived feeling that's easily resolved when you have a plan. So with anxiety, you think that you have ways, but there's always that thing that says, no, you can't, no, you can't, no, you can't. So it just blocks whatever plans you have to fight that. So it's more or less, it's basically a flight response to whatever threat you are experiencing at that time. So, but with both the depressive and anxiety disorders, they are closely associated with an oversensitive stress response system in the brain. So the researchers think that the reason both of these types of disorders are so much more in common in people who've actually experienced major stresses like child trauma or childhood abuse, so those stresses could make their stress responses more sensitive. So most people who are diagnosed with depression or anxieties, they have experienced some form of trauma in their lifetime. But what I can say to people is that, with anxiety, actually you being scared of something that has not happened. So basically you're scared, you're living in the future which hasn't happened. And then with depression, you are living in the past. So you are thinking about the things that happened in the past.
Whoa. Okay.
And then with that said, fear and anxiety are just, So with fear and anxiety is basically excessive worrying and fear. So they're just illusions stemmed from an overactive imagination, right?
So,
when it comes to anxiety. So
when you say that it's things that happen in the past, like how far back can we go in the past? Can we go as far back as child?
It can be yes, and even as far as yesterday.
Okay.
Right. So it's things that have happened. And like I said, they stem from childhood stresses, things that happened in the past, whether you were abused or you lost someone who was close to you and you just didn't resolve it. So then as an adult, that's when they start manifesting themselves. Right. So most people with depression, it's more of blaming, like they have this excessive guilt, So guilt is actually one of the symptoms of depression used to diagnose a person with depression. And then with anxiety, So now with anxiety, like I said, anxiety is just also an illusion stemmed from an overactive imagination. You're thinking more in the future. What if this happens? What if that happens? If I do this, this will happen. So in the end, the person just keeps to themselves.
Okay.
So if I was to give you like a picture, it's like driving through a red robot before it turns green.
Okay.
What put you in danger? Was it the robot, which is the situation, Or was it your decision to drive through the robot, which is the premature
My
reaction
decision.
to the situation? So it's just a premature action. Basically, in the end, the person just decides not to drive at all, basically not to live life at all, because you're thinking, what if I drive and then the robot turns red? And so, I mean, can you, so in the end, you're like, let me not at all.
Rather safe than sorry.
But that's the thing. It's not even rather safe than, it's more of, you're always focused on the negative. Like, what if this happens? What if? Being safe is you stopping at the red robot, not you staying at home and not taking action at all.
At all. Okay.
You know?
Yes.
Okay. Okay. So I don't know if there are any more questions in terms of anxiety and depression, so that we can move on to the substance.
Okay, I don't see any from our viewers, so I assume we can move on. If there's anything, we can always go back and address them.
Yes. Okay. So with substances, the commonly used substances, obviously alcohol and tobacco in terms of cigarettes, caffeine.
Beverages.
I see you're having some coffee there. Caffeine. Also.
Chocolate, actually.
Oh, that's good. Okay.
Staying away from the caffeine.
Then there's also cannabis, as in dacha, weed, and then opioids in terms of heroin, pain medication. There's stimulants like cocaine, hallucinogens like LSD, inhalants like glue, hypnotics, sedatives, and there's quite a number of lists. So we're just going to focus on those. So when we talk about drugs, we should consider what happens to the drugs when they enter the body and when they exit the body. Okay. So when they enter the body, the person, we say the person will be intoxicated. So this is when the drug exerts its effect on the body. So usually it affects the person's behavior and the person's psychology. So in terms of behavior, you know, and it's also drug dependent. So, I mean, when a person is drunk, we automatically think that the person had alcohol. So when a person has excessive alcohol or has ingested alcohol, they become drunk. And then also when a person is high, we think of things such as cocaine, cannabis, heroin, right? So that is when the substance enters the body. Then what happens when the substance exits the body? It's called withdrawal. So the withdrawal usually occurs after a prolonged use of that substance. And then you suddenly just stop the substance, right? So these symptoms, the person can present with either being very ill or unwell. And withdrawal can be dangerous and even fatal in terms of alcohol, because alcohol, when you just withdraw suddenly from alcohol, you can start experiencing seizures and then die.
Yep.
Yes, and this mostly occurs with drug dependence. So then we can also talk about the effects of these substances on the human brain. So
okay, wait, sorry. Before we move on, right? With regards to withdrawal, so I'm a drug addict. I've been at this for 6 years, and I decided to go to rehab and quit. What's the procedure there? Do they cut me off? I mean, you just said it's dangerous, so to speak. Do they cut me off, or is there limited supply, so to speak, until I can wean off them?
Yes. So with alcohol, basically it's drug dependent, like we said. With alcohol, specifically alcohol, because it is the one that is the most dangerous when you withdraw. And I know nyapa as well. So when you do withdraw from it, you would rather take it down, taper it down. But when you're in rehab, obviously it's unethical to give a person drugs or alcohol. So what happens is we give you medication which acts on the same same neurotransmitters as same receptors as drugs, as the alcohol itself. So in this case, we have what we call benzodiazepines. So we give you high doses, then we taper them down over the days so that you don't withdraw from it.
Okay, interesting.
Yeah. So then we can also talk about the effects of these substances on the human brain. So what happens is that they can either result in substance-induced disorders or a substance use disorder. So in terms of substance-induced disorders, is that the person can present with mood disorder, where it can either be depressed, also called depressive disorder, due to whatever substance that you're using. And then, or it can either be a manic disorder, which we call bipolar and related disorder, due to whatever drug you use. So the person's mood can either be elevated or it can be depressed. So now it basically substance-induced disorder means that now you have a psychiatric condition which requires medication, right? And then the substance-induced disorder can also be an anxiety-induced disorder due to whatever substance you're using, and sleep disorder due to whatever substance you're using, sexual disorder due to another substance you're using. And then another thing, this one, it also occurs, psychosis. So with psychosis, that you've lost touch with reality. So you can either start seeing things or hearing voices of things that people don't see or even you don't see, and you can start being paranoid. So this is when you get a psychotic disorder due to whatever substance that you're using. And then all of these are treated with whatever. So with psychosis, it can be treated with an antipsychotic drug, with mood and a mood stabilizer, and right. And then not everyone who uses a substance develops this, right? So it depends also on the genes that you may have. So because we don't know, I mean, you can be the unlucky one who gets it, right? Even if there's no one in the family who has a psychiatric condition, but you can be the one. Yes,
Okay.
right. Yeah. But if there is a person with a psychiatric condition at home, then I mean, it depends on the family member, but there are percentages of how likely it is that you will develop this condition. So still on the brain, another condition that can happen is what we call the substance use disorder. So we spoke about substance-induced disorder. So now we're talking about substance use disorder. So this is basically means that the usage of the substance impairs the person's functioning, whether at school, work, or even socially at home. Right. So the main issue with a substance use disorder is that there is a problem. And how can you tell if there is a problem? So you look at the use of the drug, the tolerance, and the withdrawal. So if the person has either one of the three, then there is a substance use disorder. With substance use disorder, the treatment is different from the substance-induced disorders, because with substance use disorder, you don't necessarily need to be admitted in a psychiatric facility, but it's always treated at a rehab facility, right? So with use, how do you know that a person has a problem with the usage of the substance? That's when the person uses increasingly large amounts of a substance. You can hear people at 20 of cots, whatever. So you're thinking, man, it only takes me one to get drunk. So then you just start wondering, right? And then if the person has strong desires or cravings for that substance, what? You just have to raise an eyebrow, like, oh, okay. And then if more time is spent to get that substance, or if more time is spent to recover from the substance, right? And then also failing to try to cut down or to cut back. You hear a lot of people, oh, I guess this month, I mean, this is the last day I drink. Then how next week you see them again. So you
They
can
were
just
broke.
ask them.
Just no last week they were broke. There's no such.
But you know, the desire to actually cut down, it means that even your body is telling you, hey, bruh, let's cut down. But then because your brain is now affected, it feels like it needs to continue, right? And then also if they are facing problems relating to their obligations at work or school or home, like the person doesn't go to work as often, just bunks work or comes to work drunk. Even at home, the person is just not present, you know? And then another sign, like I said, is tolerance. So with tolerance is when the effect of the substance decreases the subsequent doses. So basically, your body has adapted to this substance. If you only needed 2 cigarettes to reach the desired level, then all of a sudden 2 doesn't do it for you. You need to increase it. Increase it. Now you're up to 20 just to be where you were back then. So that is when you have tolerance. So that's how the people overcome their tolerance. Just they keep increasing the dose of the amount of the substance in order to reach the same level of intoxication. And like we already said, the other one is withdrawal. So with withdrawal, it means that now the body is dependent on the drug. So if you were drinking, like your body is used to you drinking 3 times a week, then all of a sudden you're only drinking twice. Then you start feeling ill. You start shivering, feeling all kind of weirdness. Like I said, you can even get to a point where you experience seizures because now your brain is used to having that substance at that specific dose every single time. Now, when you decrease it, all of a sudden, then now your body starts malfunctioning to a point of it goes into a seizure and you can potentially die from that.
Wow.
So that's how you can tell if a person has a substance use disorder.
Jeez.
And the treatment is rehab. And remember, with rehab, you can't force anyone to go to rehab. The person has to first ask for help.
Okay. Of big words. Lots and lots of big words that I heard there. So with the substance induced and substance used disorders, what other alternatives are there to recovery? Can I personally wean myself of the substances and then be assured that I'll fully recover, or I need you guys to come in and step in and assist?
Okay, so remember, by the time you now start having an induced disorder, it means that your brain is now affected. So I don't know if you know much about the brain, but if you do, then you can. But professional help is mostly the best way to go, right? So I think that earlier, let's say you just started smoking 2 months ago, and then you start feeling like, hi, man, I need to cut down. And then you actually are able to cut down. Then you were not yet at the part where now your brain is completely involved. So you were still there at the earlier stages. But then some people, it takes years and years for them to finally get to that point.
Okay.
So usually asking for help is the easier way, I would say.
Okay. So we've got a comment from Lerato Mimi Makumalo. She says she was about to ask as well as to how can you help or inform someone to get help when you realize that a person has any of the conditions, but she's been answered. So well done, Mahlatsi.
Okay.
Yeah. Okay, awesome. So in your experience, have you had a case whereby, with regards to the substance-induced and substance use disorders, there was no hope for this person? Their brain was so messed up, it was beyond repair, so to speak. There was no amount of intervention that could save this person.
Okay, so with substance-induced disorders, those are the ones that we at the psychiatric hospital deal with. So this means that now this person has a psychiatric condition. Let me put it into context. So, for example, we have what we call organic psychiatric conditions and inorganic psychiatric conditions. So, with
Okay.
inorganic psychiatric conditions, those are the schizophrenia, bipolar, OCDs, you know? So, those are the ones which just happen. Whether maybe there's a genetic condition in which runs in the family, or unfortunately it just happened to you, right? So those are just inorganic conditions. So the organic ones are the ones which are caused by something. Most of the time it's usually a substance or a medical condition. So now,
Okay.
putting it into like a comparison, let's compare schizophrenia. So when I compare schizophrenia with something that a drug caused, it will be a psychotic disorder. So we'll say psychotic disorder due to, let's say, alcohol. Then it will be treated the exact same way as schizophrenia. You basically have schizophrenia, but it's caused by alcohol. So we don't say it's schizophrenia. It's more of a psychotic disorder due to whatever substance that you were taking, to the point of your
Beverages.
brain getting damaged. So the only treatment will be antipsychotics for life.
Ah, for
So
life.
that's for life. So now you are a chronic patient who has an induced disorder due to a substance, right? And then with the same way with the mood, like I said, bipolar. So a person with bipolar 1 disorder, I mean, that happened or it was genetic, but it's something that you were born with, or it happened, you got diagnosed as you went by, right? Then there are those who get bipolar after having smoked weed, or not even weed, sorry, having smoked cocaine or drank alcohol for so long. And then in the end, you start having these behavioral problems, which cause an induced disorder. So you will be on the same spectrum as someone who is bipolar, then yours will be bipolar and related disorder due to alcohol, or due to cocaine, or due to heroin. And then you'll be on the same medication as someone who is just bipolar. And this is a lifelong condition. Now with substance
Are you saying I must stay
abuse,
off the wines?
yes,
I'm
start
very
having
worried.
tolerance, like I said. So with substance use disorder, this means that there is a problem. Now it's affecting your life, school, home, work. Those are the use disorders. So use disorders, the only way to treat them is if you stop the drug. Then you'll be fine, literally back to normal. That's use. So with use disorder, the only problem in the brain is that your brain believes that you need this substance to survive, to live. Right? Yeah. So that's the thing with use. So now induced disorders, now you have psychiatric problems and you'll be on medication for life. And then use disorder, at least I think the prognosis with that is better than that with the induced. So people with use disorders, I mean, you've seen them, the Nyopa kids on the streets, some hobos, some people who are actually functional alcoholics. I mean, they tell you, I can't go to sleep without drinking, you know, or
Something.
I can't survive without smoking. Yeah, so with that, they just need intensive rehab to help them.
Sure. Okay, so let's step back a little, right? Let's
Mm-hmm.
go to depression. So I've got a colleague or a friend or a neighbor. Are there telltale signs that can indicate to me that there is an issue there? Maybe I could try and intervene or try and get this person assistance. Are there telltale signs like for sure, anyone with depression, you can tell by those?
So there is a diagnostic criteria, which is from the DSM-5 criteria, right? So with that, it's just that people these days are so good at hiding. We're all wearing masks every day just to be socially appropriate, right? So when it comes to like the real legit MDD, major depressive disorder, you have to fulfill that DSM-5 criteria. A person can have here and there some symptoms based on that, but does not fulfill the whole criteria. But I can tell you one thing I can tell before I get into the criteria itself is that every single person who has a mind, anyone who can use a mind, needs to have a psychologist. Everyone, because we're all going through things, and then so basically
Mm,
mental health is more important than physical health, in my opinion, from what I've seen, especially these days with social media, where you're now in close proximity to everything that you've ever wanted, but you can't really have.
and have
And
it.
life is just so fast these days. Life is fast, and you feel like, wow, everybody's progressing quicker than I am. I'm
Mm,
unemployed, this
and
and
that's
that.
all,
As long as
yeah.
you have that mind,
Yeah.
as long as you have a mind, you need to be seeing a psychologist. You don't have to wait until you're depressed or you're anxious or now you have substance use disorders. No. Now, as you are right now, only no kulila now, you have a psychologist just to say whatever is on your mind, offload, you know. And then the nice thing about going to psychologists is that they help you deal with certain situations. So where you would react in certain ways, they teach you how to react to certain situations. Ne?
So,
So
Mahlatsi,
everybody
what you're
needs
saying
a
is, sorry to
psychologist.
cut in. So what you're saying is, same as your visits to the dentist, right? Before your tooth
Mm-hmm. Thank
and you
you.
need to make those visits. So I can't sit back
Yes.
and say "Nake shabu" and then wait for oh, okay. All
Thank you.
right.
Exactly that. Even people who go to the gym, it's not just obese people who go to the gym. Even you,
Yeah,
Olaslander, you
yeah.
say, no, I'm going to the gym not
To
because
keep
I want
fit.
to lose weight, but because I
Yeah.
want to keep fit. Thank you. So going to a psychologist is basically keeping mentally fit.
Okay. But the
Yes.
stigma, minanyasaba, you know?
Exactly. So now imagine
Texting you and telling
if,
you that I'm seeing a psychologist and you're thinking, hey, because I haven't watched your videos, I don't know, I don't have the knowledge, So I think maybe
yes.
that might be the issue, the stigma as well. As soon as you mention psychologist and we're thinking, she's gone off the rails.
So like I said, if we all, as long as everyone who has a mind goes to
Yeah.
psychologists, then it would be the norm. Remember, even gymming,
Yeah.
Kape gymming was not like a real thing. It was just kilo tadi no, tadi manje manje. Back then only athletes went to the gym. Now
Yeah.
everybody goes to the gym. I mean, like I say, even hiking. I've been hiking for years, but now everybody's into hiking. And when I started, they were like, "How? Why would you pay to go to a mountain? Mountain is free, you know." But it's the same way with psychologists as well. Just share the message. As long as you have a mind, you need someone to talk to.
Okay.
Back then when people used to go to church, it was also great because the pastors were there as psychologists to them. But now because people are woke, they don't believe in church anymore. And then now
Why
they're
is
just
Jesus
by
white?
themselves.
I wanna
You
know.
know,
Yeah,
hey, you know.
yeah.
So that's the thing. Now people don't even have anyone to talk to at all. So back then, people would go to their pastors, their priests, and they would be fine afterwards. You know, they would still have that thing. But then
Yeah.
now everything is taken away from them. So I always advocate have a psychologist. The way you have a GP, the way you have a gynecologist, the way you have a personal trainer, you must have a psychologist. So to
Okay,
answer your question about
got a
seeing a person,
comment here. Oh, sorry, it's a question actually from
yes,
Ipeng Musegen, from Dr.
yes,
Ipeng
mm,
Musegen. She says,
yes.
thanks for this presentation. Question to our beautiful doctor, that will be you. To the general public, how would one differentiate how would one differentiate from bipolar and schizophrenia? Like people use them interchangeably, you know? I mean,
Uh,
yeah, we're
mm.
not knowledgeable. One and the same, 609 like me, but how can we differentiate between them?
Okay, even though that's not my topic, but okay, so
Sorry.
with schizophrenia is more of a psychotic disorder, and then bipolar is more of mood disorders. So just to get into it a bit, with schizophrenia, a person, when we say they are psychotic, like I had explained before, psychosis is when a person loses touch with reality. So now they're living in this world, like they see things which people don't see. They hear voices in their mind, and then they're also suspicious of everyone. They're just suspicious. So that's schizophrenia.
So I think,
Mm,
based on what you said there, I think the reason why people might end up using them interchangeably, like you said with bipolar, people get a bit moody, right? Their
mm,
moods are all over the place. So 5 minutes ago, I was talking to you, we're fine, and then 5 minutes later, you are furious at me, so to speak, you know. So
mhm.
with schizophrenia as well, because I'm seeing all these things that no one else is seeing. Maybe 5 minutes ago we were okay, and then 5 minutes later, well, in between the 5 minutes, I saw something that you didn't see, and now I'm livid at you. So maybe that's where the confusions might come in.
Yeah, so like I said, it's more of their behavior. You said it best actually. The person who's reacting now with schizophrenia is reacting to what he saw or what he heard. You can always ask, how, what's up? They can tell you, didn't you hear that? Didn't you see that? Right? Now with bipolar, yeah. So now with bipolar, and that's another misnomer or misconception is that
Yeah.
when we say a person is moody, it's like just like that. It's an episode. So when you say an episode, it can take any moment, any time from a day to 2 weeks, 2 months, even a year, where the person is behaving in a certain way. So with bipolar, like I said, it's a mood disorder, which also affects the person's life socially, work-wise.
Yeah.
A good example is Kanye West. Just recently, how he
Thank you.
was behaving. That's
Yeah.
not a schizophrenic person. He was not talking based on what he was seeing, like, oh, I'm seeing
Imagining. Yeah.
things, imagining things. No, no. He was a manic episode where he Corey, he was not depressed. That's not a depressed person. A depressed person is reserved and closed off. You could see it. So with him, he was all over the place, flight of ideas, talking about this, talking about that. Everything was just wow. It was bizarre, right? Like, yeah,
Exploded.
wow. Like,
Yeah.
who asked you those questions, right? Yeah. So, if you were to meet a bipolar person and a schizophrenic person, with schizophrenia, let's say they're all both on treatment, well treated and stuff. With a schizophrenic person who's on treatment and a bipolar is on treatment, you wouldn't really know the difference. So when they start to relapse, a bipolar person would be either, let's say they'll be in a depressive episode that time. So they will be reserved, they wouldn't go out much, wouldn't be motivated to even take a bath or whatever, right? Then with schizophrenia, whatever they are doing at the moment, their behavior is influenced by what they are hearing in their mind, what they are seeing in their mind. So the person may decide not to take a bath because the voices told them not to. Or they may decide not to take a bath because they're scared they're seeing some snake in the bathtub. Or they may decide not to take a bath because they are paranoid that you are out to get them in that bath or whatever, right? So in terms of behavior wise, it's all about you talking to the person. But you will definitely see, you will know. You will know. With schizophrenia, it's psychotic, more of behavior wise. With bipolar, it's the mood which influences the behavior.
Okay. So we've got another question here for you, Doc, from Elizabeth van Veek Bezuidenhout. I hope I got that right, Elizabeth. She's asking, can a severely depressed person also see or hear things that don't exist? Like, do they physically hear and see these things, or is it because they're depressed, everything is just so negative in their mind that even when you're making a joke with them now, they get overly sensitive about it, and do they also hear, or is it reserved for the bipolar and the schizophrenic people? Sorry.
Yes, so they do hear. They do. So there is actually a criteria there that says that let's say major depressive disorder with psychotic features or without psychotic features. So the thing with mood disorders, the psychotic features are mostly mood congruent. So let's say, for example, first of all, I have to explain what those psychotic features are. So the psychotic features in moods, they usually can either be delusions. It's not common, but I'm not gonna say it doesn't happen, but it's not common for the hallucinations to be present. So when you say a person is psychotic, the person is either delusional or has hallucinations.
Okay.
So with I will go for the question was depression, right? Okay, so with a depressed person, the psychotic feature, the whatever voices that they could hear would be like, oh, you're so worthless, just kill yourself, you're worth it. It goes already with that feeling that they had already been feeling, and now they start hearing things that tell them that you are, so they reinforce whatever it is. Those are the kind of psychosis. So the psychosis could never be, oh, I'm seeing goats there, but that time the person is depressed. Because it's always mood congruent. It goes with the mood. Of note, a schizophrenic patient is more likely to be depressed because of those voices. So a schizophrenic person can have major depressive disorder because of the constant criticism that's always going on in their mind. So yes, mood disorders can present with psychotic features, but to differentiate them is that the psychotic features are mostly mood congruent. So a bipolar person can feel like, oh, I'm the greatest, or they can feel usually say that, oh, I'm the son of God, and God talks to me. So that voice that they're hearing, when we are not hearing it, they believe, oh, God is talking to me. So that's when we say the person is now psychotic. So when God talks to them, they are happy, their mood is elevated. So it's a mood congruent. Whereas with schizophrenics, usually even those voices don't really affect their mood.
Okay. Okay, so say I have schizophrenia, or it's starting out. I don't know if there's even a phase whereby it's starting out, but can I pick it up and can I be sensible enough to say, something is a bit wrong with me, and I would go, well, I'll be sensible enough to go and seek help on my own before I'm walking down the road naked and telling everyone that I am Jesus. You give me a lift to Houghton now. In 5, 4, 3, 2, 1, can I pick it up before it's so excessive that everyone now can see it?
So with schizophrenia, actually with mental disease, it wouldn't be a mental disorder if you could treat yourself, right?
Yeah.
So it's usually the people around you who can give the account that, oh, this person used to be like this and now they are not. So there is a phase, like with schizophrenia, usually when you're still a child, you have some kind of odd personality, but it doesn't really affect your life as much. But people notice that, oh, okay, this guy's kind of odd. And then they're like, yeah, no, I'm one of the weird ones. You're fine. But then when it does get activated, that gene gets activated to schizophrenia, and you start experiencing all those voices and things like that. Your family or whoever lives with you is the one who usually gets you admitted. So it's very rare. It's only if you know that you're schizophrenic, and then that's when you can tell that, okay, now I'm having a relapse. Let me go to seek help. But in the beginning, when you were never diagnosed, you yourself can't really tell, like, oh man, I'm sick.
Yeah.
you know? Yeah. So it's always, almost always the person, someone who's outside who sees that you are not well. For example, with us, we usually get people brought in by the police because the person was just wandering in the streets. So the police would ask how, what's happening? And then whatever the person says, then the police can tell, no, this person is not well,
There's
and they
something
take
wrong
them to
here.
the
Yeah.
hospital. Yes. So it's very rare for a schizophrenia or even a bipolar, actually for anyone with a mental illness who was never diagnosed to say that I am not well. It's very rare. The only type of mental disorder that does that is when you are suicidal, right? Like when you feel like I need help, usually when you're suicidal. And even major depressive patients, people who have like who really feel like I am not well, they can actually feel it because it's a huge shift. But when you're schizophrenic, when you're manic, it's like a happy, euphoric feeling, like, oh, okay, there are people talking to me. I'm not alone anymore. So you're not really
Yeah.
noticing it as much,
Mm.
yeah. And then another one is when you're older, when dementia kicks in, you can feel like, okay, no, I'm becoming forgetful. Maybe let me get checked. So awareness when you are sensible. So the fact that you're psychotic or manic, then sensibility is out of the window. You can't really notice it yourself.
But okay, now that you mentioned dementia, like, which is another thing why I really felt that it's so important for us to have these sessions, right? Like you're mentioning
Mm-hmm.
about dementia, that when you get older or old and you start forgetting, being very forgetful, and you picking up on, no, I'm really forgetting a lot. But like it has been normalized that the older you get, rather, the more forgetful you become. So when do you draw the lines? You say, yeah, I am getting old and forgetful, but this is a bit too much. I need to go get help.
So you're talking now in terms of dementia.
Dementia, yeah.
Yes, like I said, with dementia, it's subjective. Yourself, you will see, and then other people who are with you can also tell. Like, okay, you seem to be more forgetful. Let's go get help. So at whatever stage that you do find it, that's when intervention will be sent. So you can tell, like, okay, I used to be able to know my phone number, but now I don't. Maybe there could be a problem. Or I used to remember where I went to school, but now I don't. maybe there could be a problem. So yeah, depression is a whole other topic. At least with dementia, the people who are demented, everyone who's around them and they themselves can tell that there is a difference. There is a shift from the normal functioning.
Okay. So if I suspect or if I notice that there's a case of depression, bipolar, or schizophrenia in my midst, where do we go for help, or what is the first step that I can assist myself, an acquaintance of mine, friends? Where do we go? What's the first thing to do?
Okay. So with this depression and anxiety, I think there is a group. It's called the South African Depression and Anxiety Group, and they do have a hotline. Maybe if you could just Google it quickly. But
Okay.
there is
South African who?
Depression and Anxiety Group, SADAG.
Okay, I see them.
Yes. What are the numbers?
Hi, are you there, Mahlatsi?
Yes. What are the numbers?
Yeah, I'm gonna put it down there. Don't worry. I'm on the
Okay.
site now, so I'll put it down
No
there. Don't
problem.
worry. Yeah.
Okay. Yes.
Okay, so SADC, is that the only ones? Or that would be the best ones to run to?
So that's the one you can actually call. And then there's also South African Federation of Mental Health.
Okay.
South African Federation of Mental Health. And then if there is like you said, if you do feel like, oh man, I'm feeling depressed or this anxiety is too much, I need help, your local clinic, local hospital, they can definitely help you with that.
Okay. Okay. Okay,
Yeah.
thank you so much. Okay, I don't have any questions anymore on my side. I don't see anything from the viewers as well. Is there anything that you feel that we might have forgotten? Maybe we did not address that viewers might want to ask later on when we're gone.
Okay, for me, in conclusion, the reason I chose both of the three of these topics is that they are so common and people don't realize that they are linked in a way. So usually a person has a reason why they start taking substances or start using substances. And the underlying reasons mostly because of their inability to react to stress in a certain way. So a person will say, oh, today I'm feeling so anxious. Let me take something for this anxiety. And then not knowing that it will eventually become a problem in the future. Or, oh, I'm feeling so low. I need a mood booster in terms of wine or alcohol or whatever supplement they want to use. Not knowing that in the end, it can lead to certain conditions. So depression and anxiety can be managed. Everybody needs a psychologist on call. And you need to go often as you would the gym.
Sure. Okay, that might be a bit problematic on my pocket. You know, are there other alternatives? Are there other institutions, centers whereby I can go, but it won't hit my pocket or it won't even touch my pocket? Would be ideal.
Yes, I think Facebook has a lot of these groups which deal with depression, anxiety, actually all mental illnesses. If you just type in whatever condition you feel like you could be experiencing, whether you lost someone or you went through some kind of trauma. That's a nice thing about the internet. There's access to everything, just about everything. And they're all strangers, so there's no need for you to feel awkward or whatever. Yeah, and I think Gauteng and the Western Cape, you guys have nice things like where you do get groups to meet. It's just that now with this COVID, yeah, so it's fine. Everything can just be online. Yeah. So everything online.
Got another question here for you from Lerato Mima Kumalo. She's asking, what measures can one take in order to be able to deal with occupational stress or stressor?
So occupational meaning at work, ne?
I'm assuming you're.
Yes. So stress in general, I feel like in general, whether it's work, home, school, relationships, or whatever, the best way is to face it head on. Always ask yourself, okay, at this moment, why am I feeling this way? Let's say, for example, your boss spoke to you out of line or whatever, and then you decided to internalize it. You can either decide that you're just going to let it bounce off you, or you can address it with your boss at a later stage when you are calmed down and just ask, okay, boss, why do you feel that there was a need for you to speak to me in the way you did? Or how can we change our relationship in this way? So like I said, it's always fight or flight. So you can either face the stress head on or decide that you're not going to deal with it and it's not going to bother you. It's not enough to bother you. These days, there's this word going around, boundaries. And I actually like it. So you have to set your own boundaries. Decide. So it's all about you, your decision. Decide on what is good enough for you or is worthy for you to react to it. We don't need to react to every single thing in life, honestly, if you check. And most of the things, you actually, in the end, you won't even need to react to anything. So I always say protect your peace. Will it be worth it if you were to speak to this person at work or whatever about whatever it is that bothers you, or just letting it go? I usually prefer to face things head on so that they never come back to me again. But not everything needs a reaction, like I said. Not everything needs a reaction.
Okay, so the most important thing that I've taken out from what you have been saying today is that we all need to see a psychologist, right? And I'm thinking you get to a psychologist and you talk about all these issues that are bothering you. And it just kind of crept in now when you're addressing Lerato's question with the occupational stress. When you're saying that if you feel that maybe your manager is not treating you well or someone did not speak to you in an appropriate manner, and you go and talk to them about it. So like it kind of sounds like the same to me. You need to talk about it in order for you to deal with these things. So whether it's talking to that individual or you going to a psychologist and talking, but the bottom line is that we need to talk about these things.
Exactly. And like I said, with a psychologist actually prepares it, they will teach you how to react to every single situation that you may face in life. And now you feel at ease, like a whole weight off your shoulder. Because I'm pretty sure that it's not just occupational stress. It's now linked to everything going on at home, everything that happened. Maybe you didn't get your order correct, whatever, finances, all those things are here. And then, so until you get to that one core on how to manage stress, then everything will be fine.
Okay, so Mahlatsi, I do see that we're running out of time and you might need to get to other things as well. So thank you so much for the chat today. Again, very informative. So please, when we give you a call again to say, look, we need your insight, don't switch off the phone. So thank you so much. There are more questions that are coming in. I will contact you and then we can address them from what the viewers are posting here.
Okay.
So yeah, please, SOS, if anyone comes up here and say, look, I need assistance with 1, 2, and 3, I'm going to give you a call. Don't switch off your phone. Thank you so much for your time, Mahlatsi.
Okay, bye.
Until next time.
Till next time. Bye-bye.
Okay, guys, so we are running out of time, so to speak. But yeah, that was very insightful again. Thank you everyone for the questions that you put down. However, I do need to remind you guys that we are having these sessions throughout the month of August. So there are some topics that you like for this afternoon. For instance, we were only covering depression, anxiety, and the substance-induced disorders. So that's why you didn't see her going into the other stuff, your dementia and. So we are really appreciate your questions, but do keep in mind that some of the things we are not covering them on that particular afternoon. So you can tune in on another afternoon where they'll be discussed in detail and you can get clarity and ask questions as much as you can on those as well. So yeah, we are here throughout the month of August, every Sunday afternoon at 3 p.m. The women are saying they're giving us a reason to celebrate them. It's Women's Month. They're being celebrated. They want to give us a reason to celebrate them. They are here sharing their knowledge, giving back to you guys, empowering you with knowledge. And yeah, so do tune in every Sunday afternoon, 3 p.m. throughout the month of August. We are talking all things mental health. Thank you for tuning in. I hope to see you again next week, next Sunday afternoon, 3 p.m. Guys, please, if you've got any questions, if you want to reach out, you need help, just inbox us, or if it's not too personal, you can just leave it on the wall there, and then we'll get someone to assist you to the best of their ability. So thank you for tuning in. It's the end of it for today. See you guys next Sunday, 3 p.m.